Good afternoon, everyone. My name is Freddie Perez, and I am the Associate for Community Outreach at the Paralysis Resource Center of the Christopher and Dana Reeve Foundation. Thank you for joining us today in our webinar titled Supporting the Paralysis Community in Massachusetts. First and foremost, I would like to say that I hope you, your families, and the communities you serve are healthy and safe. We recognize with so much happening in the world, it can be difficult to attend these webinars and similar events. But by now, I'm sure everyone is tired of using Zoom and other online platforms. So again, I thank you for taking time out of your day to be with us. Today's webinar will cover a short presentation on the free programs and services the Paralysis Resource Center has to offer. And you will also hear from our keynote, Marlene Salo, Executive Director of the Disability Law Center. Accessing services during COVID-19, we are not an afterthought. We'll provide an overview of the services provided by Disability Law Center, the effect of COVID-19 on access to services, and we'll provide information on self-advocacy tools. The goal for this event is to share with fellow stakeholders that support and are involved in the world of paralysis, how the Paralysis Resource Center can help your communities. In addition, our keynote serves to provide information about how they may be of assistance as a community support. We are excited to share our information, and we hope that you leave this webinar with additional resources and support that you can take back to your organizations, communities, and other networks. With that being said, let's get started. The Paralysis Resource Center, also known as the PRC, at the Christopher and Dana Reeve Foundation, promotes the health, well-being, and independence of people living with paralysis, spinal cord injury, or other mobility impairment. We are a free, comprehensive national source of informational support for people living with paralysis, their families, and their caregivers. Our primary goals are to foster involvement in the community, promote health, and improve the overall quality of life. I would also like to add that all of this is possible, of course, with the support of the Administration for Community Living. Since 2002, the Paralysis Resource Center has provided resources, programs, and services that enable people living with paralysis to live independently. Christopher Reeve once said, "Once you choose hope, anything's possible." And today, not only is there hope for people with paralysis, but there is a path forward as well. As a base starter in 2013, the Christopher and Dana Reeve Foundation unveiled staggering statistics on research based into the prevalence of paralysis across the United States. According to the study, there are nearly 1 in 50 Americans living with paralysis, approximately 6 million people. Of that 6 million, 1.3 are living with a spinal cord injury. As many of you are aware, paralysis is dramatically more widespread than what one previously thought. Each year around the world, between 250,000 to 500,000 people sustain an SCI or a spinal cord injury. As many of you are aware, there are a number of different conditions that can cause paralysis. This slide represents many of the conditions our information specialists can assist with. Of course, while Christopher Reeve's injury put a spotlight on spinal cord injury, that is not the only condition that we serve. I will also add that the leading cause of paralysis based on our findings was stroke, followed by spinal cord injury, and then multiple sclerosis. As you can see here, we offer services and support for other conditions such as Guillain-Barré, spinal tumors, and transverse myelitis. So now that we know what the paralysis resource is and the prevalence of paralysis, this brings me to our first area of support. Our information specialists provide customized support and answer paralysis-related questions. What's important here are the following 3 bits of information. You can reach out to us online, via a call, or an email. Our IS team assists people as they move through the various stages of their injury or their life. We have assisted over 100,000 families since our inception in 2002, and we also offer multilingual resources that include language interpreters for phone calls, and translation services for print and web in over 170 languages. Our entire IS team is trained and certified through the Alliance of Information and Referral Systems and complete continuing education throughout the year. Our information specialists are trained to help anyone, from newly paralyzed individuals and their family members to persons who have lived with disabilities for quite some time, as they attempt to navigate their changing world and the services available to them. We pull from a wide array of information and expertise to create personalized plans and approaches to getting individuals living with paralysis back into their communities and a place of well-being quickly. At the PRC, we say, on this journey, you will have many questions. And it's no secret that the questions can be overwhelming. The PRC recognizes that how important it is for families to find the answers to their questions. It is a time that can be filled with uncertainty and fear. You feel like the room is spinning. I remember when I first started at the PRC, staff members would tell me the story of how when Christopher Reeve got injured, it felt like they were transported to a whole new world, that they had to go to several different doctors, specialists, organizations to find the answers to their questions. The PRC was Dana's vision as the place to go of support for families who had the same questions they once did, who needed the support, and who are looking for someone to tell them that there is a future ahead of this journey. Some of the questions that the IS team has received, you can see here. Some of them include, how can I learn more about home modification now that I will be returning home? Or my wheelchair is falling apart and my insurance will not cover a new one. Our IS team can help you handle the insurance process and give you more information about next steps. What should I be looking for in a rehab program? My family's caregiver is burnt out. We need help. We can give you information about respite care, other services for caregivers as well. And also, a major question is, what body changes and health conditions should I expect as I age with injury? As you know, conditions as you age will change. And so coming to the IS team for support is very important as part of that journey that you are on. Our fact sheets are updated regularly to include information and services on paralysis topics, as well as state and international resources. At the moment, we have our COVID-19 fact sheets available in line languages, which you can access online at our website, christopherreeve.org. State resources, which include all U.S. states and territories. And we also have topical resources. So anything from aging with SCI to camps for people with disabilities to playground accessibility and more information on public transportation. We do have a section on Spanish resources as well. The PRC is what I like to call a fortress of solitude. For those of you familiar with Superman canon, it's the place that Superman used to go to find comfort, information, support. Similarly, the paralysis community can find support in the Paralysis Resource Center. We are here to provide that support that is very much needed. The Paralysis Resource Center is known for its many educational materials and publications. Our goal is to keep individuals, families, and professionals well informed on topics that are important to the paralysis community. Of course, when we think about these materials, the hallmark publication of the PRC is the Paralysis Resource Guide. It's used by many universities as standard text to teach nurses, OTs, PTs, and speech therapists about the population they will serve. And it's a general guidebook for living with a healthy, active, and independent life. 210,000 copies of the PRG have been distributed to date. Our wallet cards enable people living with autonomic dysreflexia, deep vein thrombosis, and sepsis to carry critical information on their person. Our publications, most recently, we have booklets on topics from bladder and bowel management, pain management, pressure injuries and skin management, sexuality and reproductive health, a new one on pain management, as well as the preparing to transition home in partnership with Craig Hospital, as well as many more. I would also like to add that these publications, wallet cards, and books are available for free. If you are interested in receiving them, please reach out to me and we can have them shipped to you. So what's the community impact? Let's take Mylene, for example. She says, even after 20 years of living with a spinal cord injury, I still had questions that my primary rehab doctor could not answer. I used the Reeve Foundation website and forums for answers. I have also called the information specialist on various occasions. Mylene is one of many folks who continue to utilize our information services for vetted, clear, and up-to-date support. And whether it's your first year or a couple months after your injury or 20 years down the road, we are here for you. Our second area of support, our peer and family support program. Individuals living with paralysis can feel overwhelmed and sometimes alone. Reeve peer mentors provide support, emotional as well as resourceful, to members of their community, their families, and caregivers. We offer practical support for people living with paralysis, their families, and we have a unique experience as this is a more of a done this, done that kind of attitude. We match people with similar levels of paralysis and or experiences, and we offer caregiver to caregiver mentoring. It's important for you all to know that we have mentors become certified and trained. At the moment, we have helped over 12,000 people receive support, currently have 440 certified peer mentors who are also living with paralysis. We cover 42 states, including DC, and we've logged in over 19,000 encounters. The program allows for very little to high amounts of communication. People can choose to meet in whatever platform is most comfortable to them. And if it's only one question that they need help with, we can help them with that as well. On this journey, our community can help with practical experience. Questions such as, who did you use in town for home modification services? What were your experiences when hiring a personal care assistant? Have you tried any of the adapted sports programs in our area? What was your experience like? Have you ever tried the local public transportation? Is it accessible? I feel like I would like to start dating again. Can I talk to someone who's been there? It's important that these questions have answers, and it's important that the people that we connect our community with have those answers as well. So our peer mentors are able to provide that support that is much needed. The community impact. Prior to having a mentor, I had a difficult time expressing my feelings to my family and friends. They could not fully understand the grief that I was feeling after my accident. Ashley is able to relate to me in certain ways my family and friends just couldn't. Ashley knows how to encourage me, which makes accepting life with paralysis and learning to move forward much easier. Ashley and Brooke are a great example of what exactly we want to accomplish at the Peer and Family Support Program, creating long-lasting relationships and creating a sense of support that goes beyond just your general support within your family, your doctors, and your community. Our third program is our Quality of Life Grants program. I have been fortunate enough to see some great projects funded in the last year, most recently having the opportunity to see the need for accessible playgrounds for children and what that means for the development and inclusion within society. I have witnessed the difference it makes having a wheelchair-accessible van that can transport patients to and from their rehab appointments, the importance of making community centers, camps, and hospitals accessible, the creation of disaster preparedness programs for independent living centers, such as the one in Puerto Rico. There are many types of grants available. The Quality of Life Grants program strives to empower individuals with paralysis and their families. We provide grants to nonprofit organizations that improve quality of life through inclusion, access, independence, opportunities for community engagement, and other life-enhancing endeavors for people with paralysis. To date, we have funded 3,163 programs nationwide, and we have awarded $28 million. These are just some of the examples of the different types of funded projects that we've seen in the past. As you can see, we have 4 types of grants: direct effect, high impact priority, expansion grants, and the high impact innovative assistive technology quality of life grants, also the HIAT program. I would like to add that the direct grants are open twice a year, spring and fall. The high impact grants offer increasing levels of grant funding and are available once a year in the fall. Our expansion grants, which was started in 2019, is a new grant program for previously awarded quality of life grantees. And this is available once a year in the spring. And lastly, the HIAT programs is restricted to state and territory AT programs funded through the State Assistive Technology Act. Of course, you can find more information on christopherreeve.org/quality of life grants. In addition, usually when the grants are open, we will have a webinar that provides information on the application, deadlines, and examples of things that we have funded in years prior. So on this journey, grants for nonprofits exist to address the needs of people living with paralysis in their communities. So some of the questions that we normally see: who can apply for quality of life grants? And we mentioned that it's nonprofits, but as well as municipal and state governments, school districts, recognized tribal entities, and other institutions such as community or veterans hospital. What are the different types of grants? We've talked about the direct effect grants, the high impact grants, expansion grants, and the HIAT grants. Our quality of life grants available for all types of disabilities. Although we recognize the importance of funding different types of projects that are cross disabilities, we are a Paralysis Resource Center, so our focus is on paralysis and other mobile impairment disabilities. Some other questions that we've gotten in the past: what are some project examples that the Quality of Life Grants program has funded in previous years? And as well as what are past quality of life recipients? We are a past quality of life recipient and would love to bring our program to a larger audience. Is there an opportunity for that? And my answer to that would be the expansion grants, which allows previously awarded quality of life grants whose programs and or projects have achieved demonstrable successful impact. They will be awarded up to 6 grants of up to $100,000 each. So this is Enna from Ohio. There is no doubt in my mind that without the Reeve Foundation, my Compassions, Trainings, and Awareness Center wouldn't be here. They have helped me so much with the financial information resources that I needed to get my nonprofit business going. Next, our Military and Veterans Initiative. Through the initiative, we help guide service members to the military and veterans healthcare systems. We support all military service members no matter what era they served in. Injury does not need to be combat related, and we offer tailored information and referral services. We also do outreach to military treatment facilities and VA medical centers, and we connect servicemen, women, and their families with the Peer and Family Support Program, matching them to MVP peer mentors. Our advocacy and education. Educating policymakers on paralysis-related issues is a very important priority for the Paralysis Resource Center. We participate in coalitions and work to improve public policy. We build grassroots support and engagement. We develop partnerships with disability organizations, and we educate the community on key self-advocacy issues that aid individuals in their own daily lives. It's important that we recognize the need for policy and support, right? Through our Advocate for Change program, you can lend your voice to the Reeve Foundation and make a difference for people living with paralysis, their families, and caregivers. Some of the educational aspects that we've covered in the past involve insurance coverage for treatments, devices, and rehabilitation for those impacted by paralysis. We refer you to our website where you can check out our federal priorities and what we are doing to improve on accessibility and civil rights policies. We have advocated for a response for the COVID-19 pandemic to address the critical needs of people with disabilities and their families as well. Our virtual community is extensive. Social media, we have Instagram, Twitter, Facebook, our webinars and Facebook Live sessions. We have a few of them coming up actually. On June 16th, we have a partnership with the Job Accommodation Network, and we will have a webinar titled The Accommodations and the ADA. We have another webinar titled Understanding Medication Bowel Management coming up June 20th, 2020. And then we also have our Ask Nurse Linda monthly chats, which will be taking place June 24, 2020. These are all their opportunities for people to learn about a different variety of topics and ask questions about things that are relevant to their lives. Our paralysis-related blogs, we have stories from our community, updates from the Reeve Foundation, from our own Reeve staff. Currently, we have a section on COVID-19, and other things that we have discussed in the past include relationships, caregiving, mental health, and transportation issues. Our Reeve Connect is our online forum for people to create an account, and they can have a quality conversation online and engage with other people around the country. Our resource map, if you were to go to our website, our resource map is located on our front page. You would type in your zip code, and you can see any other resources available in your area. We have quality of life grantees highlighted with the gold star, as well as applicants who apply to our program, and other services such as Center for Independent Living, disability law centers, as well as other supports in your area based on zip code. And I spoke briefly about our online community, but this is an online forum where we have different types of conversations. As you can see, newly paralyzed, a new normal, health and wellness, relationships, an opportunity for people, regardless of where you are in the country, to connect, come together, and learn with each other. And before I introduce Marlene, I'd like to wrap up by saying a quote from Christopher Reeve. Here is an ordinary individual who finds the strength to persevere and endure in spite of overwhelming obstacles. Especially during these times, there are a ton of obstacles facing the communities that we serve, in particular our disability communities, the paralysis communities. And our goal for this webinar is to really come together to learn more about how the Paralysis Resource Center can be of service, but also how our upcoming keynote can be of service more locally. With that being said, I introduce Marlene Salo, Executive Director of the Disability Law Center.
Hi, everyone. I hope everyone can hear me. This is Marlene. It's a pleasure to be able to be here today and to share with you information about the Disability Law Center. And thank you, Freddie, for that great presentation. I learned a lot from that presentation as well, and I'll be sure to share that with my staff. So I was asked today to speak to you about the services that DLC currently provides to the disability community in Massachusetts. So I'm hoping that as a result of today's presentation, you'll know a little bit more about DLC if you are not already familiar with us. and that I'll be able to give you some feedback on what we're seeing in the community as a result of COVID-19 and let you know what we're doing in our own agency to raise awareness and represent individuals as needed from both an advocacy perspective and through a systemic perspective. So let's get started. So for those of you that may or may not know, we are the Protection and Advocacy Agency for the state of Massachusetts. And we are part of what they call the PAAT system, which, and you may ask yourself, what does that mean? So the PAAT, what it means is that we're part of this nationwide protection and advocacy system that works at the state level. And what we do is we protect the individual rights of people with disabilities. And we do that through empowering them and advocating on their behalf. And so we're dedicated across the U.S. To the ongoing fight, not only for civil rights, but personal rights of people with disabilities. And we do that by providing legal support, especially in traditionally unserved and underserved populations, so that each and every individual that we support and those around him or her we can help them navigate the legal system, because we want them to ultimately be able to achieve resolution. But at the same time, our goal is to make sure that the systems are encouraged to implement change. And sometimes, the encouragement may come from filing a lawsuit. Separate and apart from that, we want to make sure that all individuals that have disabilities can exercise their rights to make their own choices, to contribute to society, and to live independently. And so you may ask yourself, maybe, why were PAATs created? Well, the history goes back to Staten Island, New York, Willowbrook, which was an institution for individuals with developmental disabilities. And if you ever see a film, it's a documentary that was put together by the Geraldo Rivera, you will see that at Willowbrook, they were actually warehousing people with disabilities. And I warn you, if you were ever to look at the documentary, it's very upsetting. So Dr. Mike Wilkins kind of allowed Geraldo Rivera like a back door into Willowbrook, and he snuck in a camera, and he went around there and he, privately taped what was going on, and then he did an expose on it. And as a result of that, the New York Senator Javits moved forward to implement a protection and an advocacy system. And so when it was created with the thought that the system would allow individuals with disabilities to be independent. I mean, the PAATs would be independent. In other words, they would be able to investigate what states were doing and actually file lawsuits against the states. The PAATs would provide protection, right? Our goal is to protect individuals with disabilities and keep them safe from abuse and neglect, and to also advocate on behalf of people with disabilities to ensure that the system is respecting the civil rights of everyone, to also educate individuals in the community as well as our elected officials, and to also advocate for legislation that will have a positive impact within the disability community. As I indicated, there are PAATs across the U.S. There are 15 specific designated PAAT agencies. So there's one in every single state. There's one in D.C., and then there's also a Native American PAAT. And we all are part of the National Disability Rights Network, which is what NDRN stands for. And so that is an umbrella agency that provides all PAATs with technical assistance. And they also collectively bring our concerns to Congress in Washington, D.C., with help from the PAATs at the local level. So we are mandated, federally mandated to be exact, to investigate incidents of abuse and neglect. And not only investigate, but to also follow up on any reports of incidents or that we may hear of in the community. So what does that look like? So someone could call us because they went into a facility and they observed actions being taken against some residents that may rise to the level of neglect or abuse. And you can call DLC and inform us of that, and we are mandated to investigate it. We also will investigate the probable cause if we believe that incidents have occurred. So we'll go in once you call us, and we'll gather information, and the information is brought back to me, and I make a determination if there's probable cause to open up an investigation. We also have access to client records when provided with client or representative authorization. So let's say, for instance, someone calls us and they say, at this particular facility while I was there, medication was withheld, perhaps there are allegations of abuse or neglect. We will always ask questions to find out what documentation may or may not be available, and then with the person's permission, we will request access to those records. Sometimes we may see things that rise to the level of egregious abuse as a result of an article, a newspaper article, or as a result of information that we've received from the community, and that will prompt us to go ahead and open up an investigation and request records be sent to us under our protection and advocacy mandate. So we are authorized to provide information and referral services. So sometimes we will get calls from the community, and perhaps the person is just asking for information that would allow the person to be a self-advocate. And we will provide them with the information that they're requesting so that they can advocate on their own behalf. Sometimes we will receive calls for particular, and the request that we receive doesn't fall under the areas that we practice in, or the areas of priority that we've identified with the federal funding that we have. And so we will refer those cases out as well. However, if the calls that we receive fall under our priorities or rise to a level that warrant us to get involved because of allegations of abuse or neglect, or because we can provide independent, one-on-one representation on a particular issue, then we'll exercise whatever remedies we have, whether they're legal, administrative, or otherwise, in order to resolve the issues that we are seeing, whether it's abuse or neglect or violation of rights based on someone's disability, or for groups of individuals. So for instance, years ago, if you live in Massachusetts, you're familiar with Bridgewater State Hospital, and we received allegations that individuals with mental illness that were residing at Bridgewater State Hospital were being abused, and as a result, DLC went in and actually started an investigation, and during the ongoing investigation, and someone died at Bridgewater State Hospital, which evidence showed could have been prevented, and so we went even further, and we ended up filing a lawsuit, which was ultimately, there was a corrective action plan put in place, or an agreement was put in place between Department of Corrections, which at the time oversaw Bridgewater State Hospital, even though it was a hospital for individuals with mental illness, to remove the correctional officers from that facility and to allow DLC to go in and monitor the delivery of behavioral and mental health services. And so we've been doing that now for over 6 years, and there has been a tremendous turnaround in the delivery of services there. And so that's an example of the systemic advocacy and the systemic work that we do. So our activities are consistent with the idea that individuals with disabilities, along with their families, have the competencies, the capabilities, and the goals that should be recognized, supported, and always encouraged. Services should be individualized, and it's got to be, on par with the individual needs, using the person's strengths and whatever available resources are available. All services should be culturally competent, and individuals with disabilities and their families are the primary decision makers, and they should always have a role in the decision-making process as it applies to healthcare and, receiving any types of services that they're seeking. So under the PNA program, we have multiple programs or sub-programs, right? So the PNA is the big system, and then we have all these programs that play a role in it. And those programs became a part of the PNA system throughout the, since 1975. They've been introduced slowly but surely. So when Senator Javits originally set up what ultimately became the P&A system, it was set up under PAAT, which is the Protection and Advocacy for Individuals with Developmental Disabilities. So that took place in 1975, and that was the only standalone program that was protecting the rights of individuals. And then, 1986 came about, and that was PAMI, which is the Protection and Advocacy for Individuals with Mental Illness. And then in 93, we got PAIR, which is Protection and Advocacy for Individual Rights. And so when you qualify for services under PAIR, it means that you have 2 or more disabilities. And so we would provide services under that umbrella. And then we have PAAT, which is the Protection and Advocacy for Assistive Technology for people with disabilities, which was introduced in 1998. We have PAAT, which has to do with beneficiaries of Social Security. And then PAAT came into play in 2000, which is P&A for individuals with traumatic brain injury. And then we have PAVA, which is playing a big role lately in the work that I'm doing on a daily basis, which is Protection and Advocacy for Voting Access. And then 2 years ago, a new program was put into play by Congress as a result of Social Security Administration not living up to their to congressional expectations about looking into the rights of beneficiaries who have rep payees. And so we now have a protection and advocacy program for beneficiaries of Social Security, where we will actually will go in and do the financial reviews of rep payees and interview the beneficiaries and any guardians that a beneficiary may have in order to ensure that any discrepancies, financial discrepancies, does not rise to the level of abuse or neglect, or to make sure that it's not criminal in nature. And if it is, then we refer that out to Social Security to investigate. So that's a breakdown of all the different programs that we have and when they came into play. But now I'm going to speak to you specifically about the Disability Law Center. And our mission is the following: to provide legal advocacy on disability issues that promote the fundamental rights of all people with disabilities to participate fully and equally in the social and economic life of Massachusetts. And all of our work supports this mission. And our principles of advocacy, whenever we enter into an advocacy arena, is to ensure that individuals with disability have independence, they have control over the decisions that are being made as to the delivery of health care and anything else associated with their disability, that they can be productive in the community, they have the right to make contributions, they have the right to work, and it should not be denied. We wholly support and lift up integration, the rights to the same opportunities, services, and community resources as all other Americans, and inclusion, to fully participate and to be welcomed in society in both the educational work and community life. And that is something that we strive to obtain for anyone that is in danger of losing any of those principles, but it's the core of all the work that we do. So when we talk about self-determination, we're talking about the ability and opportunity to be able to communicate and make personal choices, to communicate those choices, and then to exercise control over the type and intensity of the services, supports, and other assistance that you're seeking, to control any resources that are made available, to obtain them so that you can get the services that you need and the support and any other assistance necessary, to obviously participate and contribute in your community, and to advocate for yourself, including developing leadership skills. And we actually work with Mass Advocates Standing Strong to provide assistance whenever they're looking. So, for instance, we were involved in the addition to not guardianship. Sorry, I'm at a loss for words right now. Supported decision making. So a lot of the self-advocates felt that they didn't need a guardian, right? They just needed support in making the decisions that they needed to make. And so they came to us and we helped them with the language that they were seeking. And ultimately, we worked in conjunction with CPR, who actually had drafted some language, and the Mass Advocates Standing Strong wanted some of that language tweaked, and we helped them with that. in order to get the bill up at the State House. So that's a very important way for them to have that self-support and be able to say, I need services. I need you to help me with maybe my bills, but I don't need a guardian for everything I do in my life. Then we also have the services in general that we offer. It's legal and advocacy services for people with disabilities who have disability-related issues, and it has to fall under our areas of practice and priorities. As I indicated before, we will investigate and monitor abuse and neglect of people with disabilities. We do policy, legislative, and administrative work. And we also work on larger systemic projects in the disability community, which has really risen to the top now more so than ever with COVID. We're all working from home. We all have a lot of the legal services throughout the community are seeing issues in the educational system, the healthcare delivery system, access to benefits. And so we've been plugging into all the agencies that do the subject matter work to bring forth the voices of people with disabilities who are also encountering these difficulties, but may be pushed out of the way for other reasons that we're trying to eliminate. So we're playing a role in those community projects that are ongoing. We also provide referrals training. We provide technical assistance on disability issues as well. So we'll go out and we'll provide training on guardianship, on your right to vote, et cetera, et cetera. So we're available, and it's free. So anyone can call us if they want us to come out and present to a group that they may belong to or to their employer, et cetera. What we don't handle are criminal matters, family law matters, anything that has to do with trust and estate, tax, consumer issues, debt, bankruptcy, or personal injury. For those, we do have to refer them out because we do not handle that under the work that we do. So I highlighted earlier the different programs that the PNA has, but I wanted to just give you a little highlight of what the PAAT program is about for us here at DLC. So PAAT stands for Protection and Advocacy for Assistive Technology, and the goal for the PAAT program, quote unquote, is to assist individuals with disabilities and family members, their guardians, their advocates, or any authorized representatives in order to give them the ability to access technology devices and assistive technology devices. And we can do that through case management advocacy, self-advocacy training, and even legal representation. And so under PAAT, we serve people with disabilities who are eligible to receive funding for the acquisition, for the use or maintenance of assistive technology devices. And it falls under the different acts which are listed here. I'm not going to bore you with it, but we're going to provide services through information and referral and legal remedies according to the PAAT authorization that's listed there. So if you're into the law, that it's there listed for you. So under the PAAT grant that we received from the federal government, what they're looking to have us do is target an intervention, the use of an AT device or an AT device to allow an individual to minimize or overcome limitations. So a PAAT case might involve representation on a Medicaid appeal, to challenge a denial of funding for a specialized wheelchair, to help the individual achieve mobility despite an inability to walk. Another case might involve advocacy at a special education and individualized education plan, meaning to get a school district to provide a child who's blind training on the use of a voice dictation software program. And another case might involve advocacy to obtain training to use a voice dictation software in a public school program or anywhere else. So keeping all of that in mind, how has COVID affected the work that we're doing, and how are we fighting for the rights of people with disabilities during COVID? So as we know, COVID's impacted all Americans, and the National Disability Rights Network, with the support of all the PNAs, we've been urging Congress and the administration to safeguard the rights of people with disabilities in the federal response to the pandemic, right? And that fight continues. And it includes equal access to testing and treatment. Sadly, we saw that the nursing homes have been hit the hardest And we've had a lot of positive cases as well as deaths in the nursing homes. And at least in Mass, we're seeing, right, an uptick in the testing, and it's being made available to everybody. But perhaps, and I can say that some states have not been as quick to respond as we have been here in Massachusetts. Then we're also talking about access to personal protective equipment like masks and gloves. We've been doing a lot of advocacy across all realms, you know, from correctional facilities to nursing homes to schools to private homes, making sure that masks and gloves are available to everyone. So an example is DLC, along with CPR, Paralyzed Veterans of America Northeast chapter, and many other disability and health disparity public health advocates. We've been working nonstop to change the first version of the crisis standards of care that were issued early on during the pandemic. And I don't know if everyone here on the call is well-versed on that, but when the crisis standards of care first came out, they excluded people based on long-term life expectancy. So in other words, if we had reached the point where individuals, the hospital was overwhelmed with individuals that were positive for COVID that needed to be placed on a ventilator, there was this grid that would be used by the doctors in these facilities to determine who got to the front of the line to be put on a respirator. And they looked at long-term life expectancy, and of course, based on how long your life expectancy was, would determine where you were going to be on the line. So we're trying to dial that back to near 5 years or less in life expectancy. And there were a lot of conversations, right? Like, what does this look like? Does this mean that if I have a co-occurring medical condition that may put me down further in the line? Does this mean that if I'm young, but I have this medical condition that shortens my life, that I'm going to be put at the back of the line over someone who's older but is deemed, quote unquote, healthier? And so those are the things that we've been going back and forth on. And we're looking at what's in New York to see if that will be adopted. Now, thankfully, we're at the point now where the hospitals are not overwhelmed. We've seen a significant reduction in the amount of individuals that are extremely ill and that are on the respirator, and so the ventilator, sorry. And so we don't want to let go of this topic, though, because the bottom line is, if it reoccurs in the fall, we have to make sure that whatever standards of care the state puts out, that they're the ones that are in place that we are comfortable with. But here's the caveat: each hospital has the independence to determine whether they'll be putting those standards of care into play, or they're going to do their own. Some additional advocacy that we've been doing is nursing home monitoring. We have individuals living in nursing homes that are there for medical reasons and not because they're elderly and have medical reasons. And so their concern remains over access to services while they're there. You know, is there enough gloves and masks to go around for the individuals that work there? Is testing being done? And so we've now implemented what we call virtual monitoring, and we just started with one of the facilities that is not nursing home related, but we're going to roll it into the nursing homes, where we've been able to coordinate with a facility that we monitor on a regular basis and put up an iPad, which allows us, and then put out a sign-up sheet where individuals can indicate when they want to speak to our attorney, and the attorney will be live on the iPad, and folks can come in and chat one-on-one with the attorney with the door closed to bring up any concerns they may have. At the same time, we're hoping that once we go in the nursing homes, that we may get someone in the nursing home to actually use a device like that iPad or their iPhone or other cell phone that has a camera, kind of walk through areas without violating anyone's privacy, just to take a look at what's going on. We're hoping to be able to do maybe a roundtable discussion using the iPad with some residents and some facilities. So we're trying to think outside the box as we get to the point where everyone may feel comfortable in allowing face-to-face interaction, as long as we're abiding by the requirements of masks and gloves and the distancing. And until some of the facilities decide that they're going to allow someone other than a relative, who as of this week, you can have relative visitation in the nursing home to come in. So we're also doing advocacy around data gathering and infection control. And so that's very important. PCA-related issues, we continue to look into those. So one of the issues that we keep hearing in the calls with the AG's office from consumers in the community is PCAs don't have access to gloves and masks like they should, and there's a major concern about that. And although here in Boston we do have the SEIU that provides masks and gloves to PCAs, they're not really hitting every single PCA that's out there. So while they may have been able to provide masks and some gloves to 15 to 20,000 PCAs, we do have a workforce of over 58,000 individuals who serve as PCAs in Massachusetts that may not have an ongoing access to gloves. So I just wanted to indicate that if any PCAs need gloves, that the SEIU is serving the entire state. They're dispensing 20 masks at a time, which I know is not a big number. But on their website, you can actually fill out a form and send it in if you're seeking masks for yourself or for PCAs. One of the other issues that we hear is that individuals who do have PCAs, they would prefer to have the mask themselves because they want to be able to provide those masks to their PCA when the PCA walks in through the door, rather than having the person that helps them come in with a mask that you may or may not know where they may have been with it. So we continue to advocate to ensure that supplies are available and can be increased. We've also, from a PCA-related issue, is the state failed to apply for a waiver to allow any family member to become a PCA, which has been extremely difficult. So we've received calls from the community where they're saying, my PCA is scared to go out, my PCA is scared, herself or himself is ill and they can't come and help me, and what am I supposed to do? And so if the state has filed for the waiver like they should have, then we would have been able to have a family member for the individual actually qualify to be a PCA and provide the services as necessary, and actually get support for it. So that's something that we've advocated for. We've also implemented efforts to make a workaround related to home health aides to also actually function in a similar purpose to PCAs, and we've made attempts. There's been attempts by the feds to also change, and this I failed to get more information, but if anyone's interested in the last bullet point, I can provide it. Attempts by the feds to change the PASRR regulations to make it easier for people with complex disabilities to be kept in nursing homes. So in the coming months, what are we going to be working on? So issues that have been raised by our consumers has been communication, just lack of communication or impossible or difficult communication with their healthcare providers. We're looking at one of my slides is off point, so I apologize for that. I missed a slide. So DLC in the past worked on a, whatchamacallit? Give me a second, please. See, I knew it was too good to be true. There would be technical difficulties of some point. DLC actually held a conference to address wheelchair repair and just to provide wheelchair advocacy. And so as a result of the conference that we held, what we discovered was that the consumers were saying that they were having a hard time communicating with the wheelchair companies, right? The companies that had issued their wheelchairs, that they were seeing a long length of time for repairs, that there was actual misunderstanding or lack of understanding and training for vendor customer service staff. And there was also confusion over the difference between Medicare and Medicaid rules. And that's what we got from the consumers. But then from the vendors, we heard that there was red tape and paperwork and issues with doctor response times, et cetera, in order to get what they needed to issue the wheelchairs, inadequate payment rates, and inability to retain quality staff. And so those are several issues that were brought up during the conference that we had. But then as a result of that, we started to expand the wheelchair repair legal advocacy that DLC provides. And so an example of one of those advocacy pieces is there's Fred, who was a man with severe traumatic brain injury and severe physical limitations. And he actually contacted DLC after many months of experiencing serious issues with the functioning of his power and manual wheelchairs. So we reached out, provided legal advocacy on both wheelchairs. And so the repairs were commenced and steps were taken by the vendor to completely replace the inappropriately fitted manual wheelchair. So through this advocacy, we've had the opportunity to represent clients, also appealing a denial for a medically necessary standing wheelchair. And moving forward, we'll continue to actually do this work. We actually now have a Pike Fellow that will be joining us, who's going to work on this area, specifically wheelchair repair and legal advocacy for those that are having problems with standing wheelchairs, and work in conjunction with two of our attorneys in-house that do this work. But before I get to like my last slide, I wanted to bring up some other important issues that didn't make it to my slide deck because it was discussed today among some of us. But, you know, when you think of COVID and you think about, I guess, the future, right, of its effect, like the effect that it will have on individuals in the future, you know, one of the concerns that we have is folks who have limited mobility or are in a wheelchair, you know, how the virus can also affect you from the sense of we're seeing that it's causing muscle weakness. In some individuals, you know, an increase in skin lesions. It's also causing digestive problems. And so how can we, as a community, kind of brace for the outcomes that coronavirus may have on those individuals who actually contracted it and its long-term effects on them physically. And so the other thing that we know is even those who may not have been using durable medical equipment in the past, there have been some serious, I guess, results of this virus on some individuals that will ultimately lead to and even increase their use of durable medical equipment, you know, conversations that have been taking places. Are there any types of specific cushions out there for wheelchairs that are available and that can be used that makes it easier to wipe them down and disinfect them? You know, and how does this affect not only you physically, but also, you know, from mentally, and what type of counseling will be made available through your healthcare provider? Is telehealth being made accessible to everybody, even though the governor said it would? You know, we've seen a couple of calls recently where some facilities are not embracing the accessibility to a telehealth appointment. And so what kind of effect is that going to have on someone who can't physically go to a hospital out of fear, right, that they will be exposing themselves to COVID? We've had another call recently, which although it wasn't directly related to COVID, also raises concerns about whether this will continue to appear in future calls where an individual entered a hospital and the individual had used a motorized wheelchair to get around, but use of the motorized wheelchair in that particular facility was denied. And as a result, the individual was forced to use a manual wheelchair, which has now left the individual with some pain in the shoulder and some other physical difficulties. And so we will be getting involved with that from a twofold perspective, right? To do some individual advocacy, but also to provide some training in technical assistance and just education as to how that should never be something that takes place. But, you know, will that end up being an additional issue that comes across our desk as time goes by and we see additional effects with COVID? And so that's just something to keep in mind. And for the final slide, I did mention that we've dealt with clients appealing a denial for medically necessary standing wheelchairs. And so I have this slide, and I know Chris is participating in today's webinar. So this is Chris Ho featured in both of these pictures. And Chris was the story of the Wheels of Justice documentary film is actually about Chris. And it shines a light on how people with disabilities are fighting for their legal rights in a society that has yet to fully realize that these rights exist. And it's told, the story is told through his journey, who has been living with paralysis since a spinal cord injury in February of 2017 as a result of a skiing accident. And we would thank the Christopher and Dana Reeve Foundation for their financial support to put together this documentary film. And I actually have a link to a 1.5-minute teaser, and I'm hoping it works, so fingers crossed. And I don't know if you'll be able to see it. Possibly not. But anyway, we can send the link out, which is up here on the upper right-hand corner, so that you can view the piece of the documentary that kind of introduces the work that we're doing. And I am more than happy to take any questions that you may have at this time.
Marlene, thank you so much for your presentation.
Oh, you're welcome. Sorry. I thought I lost everybody. I was like, oh, no.
No, it's fine. No, it's fine. I'm scrolling down right now through the questions to see if there are any or if any more come up. We do have a question from Dawn. The question is, we have been looking for years for a peer match to be matched with my daughter, who is 8 years old and has a C5, C6 injury with limited arm movement and no hand movement. How do I find someone so she can meet like herself? Dawn, I have your email here on file. I will reach out to you personally and connect you to our program director for the Peer and Family Support Program, and we will try to make that happen for sure. And that is the only question that I see at the moment. But Marlene, thank you so much for giving us an insight on the work that the Disability Law Center is doing in Boston for the Commonwealth of Massachusetts. We understand that the work that you guys do is important, especially during these times. And please feel free to reach out to us to see how we can assist in any way. I would also like to thank all of our participants today and listeners, wherever you are connecting from, whether your office or home. We want to thank you for joining us today. I will follow up individually for any questions, or if something comes on later down the road, please know that you can reach out to me at fperez@christopherreeve.org. And so, yeah, thank you so much for joining us today, this afternoon. Marlene, thank you again. And we look forward to see what the next steps are in our work. Again, the overall objective of this event is to bring together stakeholders of the paralysis community in Massachusetts to learn about the Paralysis Resource Center, but also learn about a local support, in this case, a Disability Law Center. Please reach out to Marlene for any questions, for any ways that you guys may be able to collaborate, work together. Ultimately, we are here for our community to make sure that that we work for them, that we advocate for them, that we provide as much information as possible for them. So with that being said, thank you, everybody, and have a good and safe afternoon. Take care.
Thank you. Okay. Bye-bye, everybody.